So then again, I would like to remind everyone, no, to at least prioritize, no, our written outputs as well. It's because it also gives a higher impact into your grade. Remember that your outputs for the written output is comprised of the 40% of your total grade. Aside from the presentation that you had, no, all of you already had grade with me. I already graded you, and the only three of you who are the last presenters who don't have yet some grades. No, so anyway, this is our last meeting. I believe that you guys are all present. All the presenters today are present, so that will not be a problem anymore. Okay. And aside from that, 20% comes from your attendance and participation. So if you are perfect with your attendance, for sure you'll be able to get a 20% then again. Okay. And at the same time, participation wise, anyway, no, for the participation, you guys are able to participate every time that we do have an interactive discussion. All right. So last presenters, are you guys ready with your presentation?
Yes, Doc. Novi siyang mauna, Doc.
Ah, okay, good morning. Pasensya sa akong tingog ha, kinda not feeling well jud tang diring dapita.
Okay, that's fine.
Mm. I start na the report, Doc. No, I will try to share
Yes.
my screen first. Naaring makita? Wala pa?
Yes. We can see it that you're sharing your screen.
Yeah, wait sana. Mhm. Okay. You can see this, guys.
Yes, but
Okay.
it's being shared by a cell phone, no? So
Yes,
would
Doc.
it be okay if you are going to do it in a landscape mode?
Wait sana, Doc.
Mm. Try to flip your phone.
Okay. Uh, wait sana, Doc. Ha.
No problem. Ano akong camera? Oh, tsaka ka itong camera.
Saan man na siya play daw. Okay, this one. Klaro na ni guys.
Klaro na, ma'am.
Yes, cannot see. Did you try to do it in a landscape mode?
Yes, Doc.
Okay, all right. Madi ay ano di
Kani
ang
Doc,
phone mo?
okay na ni?
Yes. And by the way, guys, no, if you will be using your phone in your upcoming presentations, if you will have your reporting, no, it's good to flip it so that kuan siya, maklaro siya.
Mas klaro siya.
Mm. Sige, okay, it's visible on
Okay,
my end now.
okay. By the way, good morning again, guys. Good morning again, classmates. Good morning, sir. Um, Today I will be talking about the record management system, which involves the nursing informatics, decision-making tools, and theories, change process, and handling resistance to change. So, first of all, record management system. So, what is record management system? Is a management of records for an organization through the records life cycle. The activities in the management includes the systematic and efficient control of the creations, maintenance, and structures of the record along the business or any organization located with. So for example of this, di ba, the supervision and administration of the digital or paper records regardless for the format. Report yung sorry. Then next is the record management system, no? Is the manage of the record for the organization throughout the record life cycle. Mao na siya. So we have here the two types of record management. The first is First is that we have the traditional paper records management. So, as the usual, we use it, di ba, pag sa hospital, we have this records of the, uh, if you are familiar with the patient records, di ba, we have this, the front page, and then the assessment page. So, mo nang ato ang via paper hard copy na ni siya. Then, we have the electronic records management. So, here in record management, so in our hospital, we use the HOMES. This HOMES means a, the what you call this, the integrated hospital operation and management information system. So dito sa amo, so tanan mga details, mga information sa by electronic naa din ha, like for instance, di ba, natay mga paper, natay mga records na only doctors are able to be accessed.
Hello, connection check.
Doc? Napa
Yes.
ba sila? Klaro pa ko, Doc?
Yes, Doc.
Yes. Okay.
Oo. Okay, okay.
Medyo nawa ka diyot, no? Sakto ba?
Dog, nawa, dog.
Yes, Doc.
Okay. I thought
Yes, Doc.
it was my connection. Okay. So I'll
Okay,
be interrupting if ever, Miss Novi, if ever you
apo,
are
apo.
lost. Ha? Sige. Thank
Okay,
you.
thank you so
You may
much, Doc.
continue.
Okay, the weather also here murag cloudy day na jud diri sa among dapita. So as I have said, the traditional paper records and the electronic records. So the traditional katong mga hard copies nato na usually na gamiton nato sa ato ang mga stations wherein kanang, for example, kanang mga waivers, di ba, wherein na makuha na to sa ato ang mga pasyente. Then naatay electronic records wherein na kaning electronic records only authorized person lang jud na siya pwede mo gamit. Naay mga access ani is at it's either atong mga supervisor, atong mga head nurses, ang ato ang mga um, IT, sila lang dyan, authorized person only can use this electronic record system. Unless if naatay ka ng access din ha, pwede ta mo gamit ana, pero if wala, we cannot. Then 10 benefits of record management. So I have here 10 benefits. Unsay mga gamit na ni, so we have the control, the generation and growth of records. So unsa may pasabot ani, means to say it is the controlling of this, the growth of the record is kanang laging ma-save jud siya all throughout. Then with this, diba, you can see the reference, ma-update ra jud nato as we go on, dili na siya kana laging katag kaayo. Then the next one is the effectively retrieve and disposes records. So within this, dili na siya kaayo kanang dili siya katag, then effective siya by kanang for keeps and for dispose. Dali ra if natay, di ba, by label naman dyan na siya daan. Then so kung natay ka ng kinahanglan ng mga papers or mga records, we can easily find it kasi naka-labeled naman na siya, and then kanang organized man siya. Then stimulate your records management technology. So as we go on, di ba, sa una wala pa jud tay anang via computer, ingana naaman pero dili kaayo same karon na enhanced na kaayo na these records na pwede na jud siya ma-segregate all throughout the hospital. Like for example, in our hospital karon, di ba, sa una ang maka-access lang sa mga radiologies and kanang mga x-rays na mga results is sila lang jud. So we need to go there and ask for the hard copy, or ang doctor pa jud mo tungha dito, pero karon murag systematize na siya. Then kung makita na jud siya dayon sa amo ang computer, if ever na the doctors or the nurses need the copies without any the hard copy pa, at least na ana sila kanang makit-an dayon na resulta if ever wala pa ang mga hard copies. Then regulatory compliance. So this one is also kanang good record management to avoid penalty sad siya kanang, di ba naaman tay mga klaro ra mo guys? You can still hear me?
Yes, ma'am.
Yes,
Okay
ma'am.
ra, ma'am.
Thank you. Kay ni Echo manggod na ako. Okay, thank you. Then ang kaning regular compliance, di ba? Di ba every year, every kwan na aman jud na kanang mo visit sa atong mga hospitals, di ba, like for example kanang ang PhilHealth, ang IPCC. So with this record management na naata, we are easily can give them what they want or what they need to us, kay dili na jud siya kanang easily to keep jud siya. Then minimize the gestation associated risk. Oh, di ba? By this one is kanang, di ba, mas dali na to siya makip, then kita ray makaibaw, for example kanang atong mga supervisors na naabi mga records na kanang access lang jud para nila, di ba? Dili na kailangan na kanang i-hard copy pa jud na siya, makitaan pa jud sa lain. So they have this such thing na kanang sa system lang jud na only mga supervisors or mga heads lang jud ang makakita. And kanang sito ganina, it 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 is it is it is really we already can give the privacy for our patients. Then number 6 is the safeguard important information. So mano ni siya all same reason siya na kanang we can keep and provide privacy with our not only with the patient and also with the hospital side. Then number 7 is the cut cost, save time and effort. So di ba dili na jud kaayo ta kanang kanang ang uban mo suwat pa jud daghan daw, di ba? Ready na jud siya. For example, we need the waiver, so i-print na lang nato siya kay naa na siya sa system, ing ana, or uh, we need to tell the doctor na maoni unsay status sa atong mga pasyente, dili na lang jud kanang tawagon lang nato, no, so they can view na lang dayon sa ilahang mga access na mga system. Then better management decision making. So with this, mas dali na lang jud ang mga transaction nila in terms of making decision, kay di ba before we have this so-called na because of the writing na dili mabasa og tarong, so dili sa dayon unsay ma-misinterpret nato kung unsa to gisulti didto or unsay suwat dito. So via these technologies and this record management, so mas madali in making decision, kay mas dali man ang access, mas dali, even dili na magkuyog ang mga doctors ani mag-tackle if they have the access of these records. So they will able to read and they will able to make decision, even dili sila kanang mag-gather kanang para makita lang nila tanan kaning record sa iyang pasyente, di ba? So by this pwede ra jud nila ma-scan or pwede ra jud nila ma-view dayon. Then pre-service company knowledge. Oh, this will be also help our staffs, ang atong mga kuyog sa hospital na kani, di ba, they call the preserve company knowledge. So naamang gud tayo time to time na i-update ang atong mga papers, i-update ang ato ang mga mga gigamit sa hospital, like mga for example sa atong mga NCP, di ba, sa una we used to have the NCP na kanang kinahanglan jud is isuwad jud nato. I don't know if sa laing hospital ing ato ra gihapon, but sa amoa is mura na lang siyang checklist, so i-check na lang nato if unsa atong gibuhat sa ato ang pasyente. Then keep employees motivated. So ngano man siya na-appeal sa benefits na to keep employees motivated. So why they put this? Kay with this system or with this management, they motivate to enhance pa jud, to enhance na mas pwede pa nila mabuhat na updated, mas pwede pa nila mabuhat na kanang easily and not time consuming kaayo. So mao to siya the 10 benefits of record management. Then here we are. We will talk about the informatics, nursing informatics. So when we hear nursing informatics, this is the specialty that integrates nursing science with multiple information and analysis science to identify, management, and communicate data, information, knowledge, and wisdom in nursing practice. Diba? So, nurses, it's really important as well, other healthcare informatics um, like, dili lang man, it's not only about for the nurses man. It's also with the other staffs in the hospital. So, useful kaayo ni siya. Then, nursing informatics is a field of nursing that incorporate nursing computer and information science to maintain and develop medical data system to support the practice of nursing, and to improve patient care outcome. So technologies that have involved due to the healthcare nursing informatics includes, so we have the so-called the computerized providers record, so the CPOE. So sa amuan natay mao na to, the homies, ang among gamit is ang homies. So electronic medical records, with this, di ba, it's really easy na natay test result dayon by by using sa amoa. For example, in a hospital, by using this homies, it's direct na ang access by the test result, prognosis notes of our patient, nursing notes, and medical records. So with this, Moragi, um, our homies, they designed this na everyone can access but authorized person only. So with this, everything makes things easy jud siya. Then we have the three building blocks of nursing communications. We have this data, then the information and knowledge. So what what is data all about? So with this data, it includes direct observation that do not need interpretation, such as like patient name, di ba? Then age, vital signs, and disease history. Then the next is the information is the data that has been interpreted. For example, includes na ana din na, for example, the prevalence of hospital acquired infection by care unit. Mani siya ang example sa information na pwede nato mag-gather, like the percentage of patient care delays output clinic by the specialist. Oh, bale kanang very helpful na jud kaayo siya. Then we also have the knowledge. What is all about the knowledge? Is the alignment of the information to identify relationship that provides further observations to an issue. My first example is the effects of nurses, patient ratios, and patient outcome. Then we have also the developing care protocol, like for, di ba, all the hospitals, we have our own protocols that we implemented in our hospital. So this kani ako, it's just an example lang na pwede nato ibutang, like the anaphylactic reaction protocol, di ba? Karon jud ang pinakakuha nato is the protocol of the COVID-19, di ba? So, what to siya? Then, nursing information roles and requirements, definitely skills and qualities. So, manigi sulti na with this nursing informatics, this dili ra ni siya basta-basta lang na pwede ta. We have this so-called the requirements or the qualifications to be able to have this. First, we need to be a bachelor degree in nursing, BSN, then a master degree and certified practitioner for executive role, like kani chief nurse, nursing informatics officer, so daghan siya title. Then experience and or strongly understand of work in clinical setting. Of course, it's really important na experience sa data or we know what is in our work or what is the nature of our work, especially in the settings. Then strong technical skills, ability to quickly adapt to emerging technologies and innovation. So yes, it's really important, especially nowadays. So we really be skillful in using the technology, Jude. Okay, if we are not, so mura siya, we will be left behind of the trends. And useful to siya, especially karon sa atong mga hospitals and other work. Then strong project management skills, of course, di ba? Mao gani na kanyang we are right now we are taking up our master's degrees so that we'll be able to have this based on our experience and also with the skills that we have and for the knowledge that we will be having with this course that we have right now. Then an affinity of obtaining analysis and strategic thought data. Then understanding of medical economics, so it's also important. Then strong interpersonal skills. It's really, diba? Kaya if we don't have this, diba, more we're not confident and we are not competent. Then the last one is the leadership experience. So as we all say that everyone can be a manager but not everyone can be a leader. Kay lahi jud kaayo if you are a leader, but it's very good to be a leader with leader that you know how to also to hear your subordinates. Dili lang kay tungod lang ikaw lang. So leadership experience is really one of the roles and requirements of having this nursing informatics. Then, few of the major jobs title, mao niya akong gisulti na if you will become one of this in the future, the nursing informatics specialist, the nursing informatics clinicians, then clinical nursing informatics specialist, the chief informatics officer. So, kani common man nino, we have this common the chief nursing informatics officer. We all, di ba? We are familiar with this. Then the preoperative informatics nurses. Then let's go with the decision making process. So decision making process includes the conclusion about a patient status and needs with a determination of a method to implement to the best meet patient needs includes an assessment of the patient response. So decision making, it's really important to have this decision making because it influences their effectiveness in a clinical practice and make an impact on a patient lives and experience with the health care. We have the decision making tools and theories. Number one, we have the market research. So what is market research? Is an essential tool, especially when you are gathering the information before making a decision. So, di ba, when when we do such a project or natay ganahan i-implement sa atong hospital, we do research. So, mo search ta before we gather like informations and if naatay mga pwedeng mga taho na ma-interview bahin aning mga research or ganahan nato implement sa ato ang hospital, so we do first this marketing research before we make a decision. Then the next one is the decision matrix. So you will be critically analyze all the available opinions or alternatives of a particular decision. So, kani siya, ang decision matrix is we seek for many opinions na kanang pwede magamit sa ato ang project. For example na in our hospital, di ba? So, if we want to have a we want to have a psychiatric ward, for example. So we need to seek for an opinion sa ato ang mga lain ng mga hospitals or mga kanang hospitals na expert for that, na unsay joining nindot for this. Then we gather all the we will analyze, and then we will have all the available opinions or mga kanang pwede nato na masik na para mabuhat nato kanang ward. Then after that, we'll do the decision na. um Use of the comparative analysis to find the best opinion to help you make decision. So mangita jud ta na best strategy or decision wise in making your what do you call this, in making your project into a reality. Then next, the cost benefits analysis. So cost benefit analysis. Here you will be take time to assess all the costs that will be involved in decision taking and the benefits that the organization will be gained from this. Or di ba, for example, as I have said, so want to we want to have a psychiatric ward. So we will we will we'll talk about this, and we will see if this kind of project will be give us, or will the hospital be benefit, what is the benefit of the hospital with this if we have this kind of a project, or if we build the psychiatric ward in our hospital. Unsa man jud ang pwede mahatag anang ward, or unsay atong ma-benefits, what will be the greater benefits we will gain if we have this kind of project in ana siya. So cost and benefits, kung mugasto ta ing ani ka kwan, unsa kaha ang return ani sa atoa. Mauto siya. Then we have the number 4, the T chart. So this T chart is also among the best tools that can be used for the comparative analysis. So mao ni siya ang gitawag nila na pros and cons of any opinion that the organization may be considering at the end of it all. So dili na mahitabo ang pag-weigh nato ba? Pag-weigh nato if we do the project, this unsa ang advantage of these advantages of this kind of project na ato ang buhaton. So if lamang ba jud ang advantage if we have this, or disadvantage na siya. So making decision jud siya. So kanang weighing ang pasabot sa T-chart is you need to weigh if it is advantage or disadvantage ba na sa atoang part and sa part sa atong hospital. Then we have this so-called SWT analysis. So accordingly, this is a common use for strategic plan and eventually decisions making using the SWT analysis. The weakness are also considered in a view of the available opportunities. Then the organization, the organization will also consider the possible threats before taking any course of action. This is an effect tool as it allows entrepreneur to analyze the company for all possible angles before taking a decision. So, mao ni ilahang giingon na if you have this strategy, dili nimo siya makit-an if kanang successful ba siya, or ang strength ang strength sa atong project ba, then ang weakness sa atong project na atong gibuhat, then unsay opportunity na pwede mahatag aning proyekto sa atoa, and unsa kang trends ang pwede ihatag ani niya nato. Then we have also Pareto Analysis. So this Pareto Analysis is commonly referred as to know the Pareto Principle. And it is common when organizations have to make huge decisions. This is inclined towards the prioritizations in by a percentage ni siya. 20% of the factors that contribute to 80% of the organization growth will be given the priority. This will be given the decision that have the highest level of impact top priority. So, ang kanidi ay kwan paretory analysis is they will gather all all the informations and see if it is uh, what what is the priority with the project, or priority ba dyan ang project na atong buhaton, or it will be end up with nothing ang ato siya. Then the last will be the feasibility study. So as I have known, these feasibility studies used in the strategic plan usually it is case they will assess the possibility of creating a specific project, and if it is can make profit used for the launching or new product, project or services ani siya. So feasibility study, so mao ni siya na if kaning project na atong buhaton um maka-profit ba jud ta ani, or will end up na kanang malugi rata or wala tay makuha ani. So next is we have a change process. So the process of changing organization, change of version from the earliest stage of conceptions and preparation through implementations and final to resolution. So change. Everything has a changes sa ato ang especially sa atong hospital, di ba? Mo change man jud na siya for the good and for the betterment of the hospital. So um this process, di ba, mao to mo guide sa organizational changes nato. Then for example bitaw ani is the, di ba, natay mga implementation of a new technology ingana, then merge and accusations for, then change in leadership. So unsa man ni siya mga change in leadership, it's either mo change ang kinsay mo mo handle, or we have a new leader or a new supervisor in the unit or in the certain hospitals dyan siya. Change in organizational culture. So they pwede siya kanang na-change um ang usual na atong gibuhat, i-change nila because kanang for the betterment or because mao na ang trend unsahay. And then, di ba? Then I want to talk about the organizational change. So this organizational change refers broadly
Hello,
to the
Novi.
action.
Excuse me.
Yes, sir.
Yes, you're almost 30 minutes in your report. Can you wrap it up in terms of your
Oh,
discussion?
okay, Doki. Oh, okay, Doki. Okay, we'll go with the adaptive change. So kaning adaptive change na um kanang we will hiring a new team. So morning new team na demand or implement a new work from for example kanang ang atong consultation, di ba, during pandemic nahimo siya kanang work from home sa uban kay they have they so called na kanang online consultation. So ma-adapt for a change. Then transformational change, na kanang mo launch ta a new product or a new market para na maengganyo sad ang mga pasyente na dito mo magpa-check up or dito magpa-consult sa atoa, di ba? Especially kanang sa mga bago na hospital, di ba? So they need to make transformational change in their strategic to gain a uh, to have a patient na sa ilang hospital. Then change management. This change management has a 5 step in changing management processes. One is the prepare the organization for the change. So kinahanglan jud ni siya na dili lang ta basta-basta na kanang we change lang dahil na without letting them know, without letting them tell na naaday tay plano na mahitabo ning ingani na kwan na trend or ingani na situation, di ba? Dapat i-aware, i-acknowledge sa ato ang mga subordinate. Then, craft a vision and plan for a change. So, kani siya na siya the strategic goal. So, we need to have a goal. Nga naman, what goals does this change the organization, di ba? Mana ang usa ka pangutana, nga naman, nga mo change ta ani. Then, key performance indicators. So, unsa man ni siya, ang mga question jud ani is, how will you succeed to be measured ba jud kung sakto ba jud ni siya? What matrix ba jud ang needed for this move? Or what the baseline for the things currently standard? Ano siya then? Project stockholder. So, who will be? Kinsay mo handle for this? Then, project scope, mani siya ang step and action sa project na ato ang ganahan na buhaton. Then implementing the change, this will be the management must be focused to empower their employees. Mo na siya. Then enabling change within the company culture and practice. The changes the manager jud ang must be prevented a reservations of the priority stage of the status. Then review the progress analysis. Of course, we need to review if it is the project goal ba na meet ba nato, or if na meet nato okay nga naman na successful. Then if wala, so dili biya tanang project mahimog successful. Dili ibig sabihin na if we have this project then agad-agad na magiging successful. So we need to analyze and review if we meet this or if we achieve this. Then, lastly topic is the handling resistance to change. So, ni identify. Nga naman, kinahanglan ni ang ato ang handling. So, we really need to have this. Identify the root cause of resistance. So, syempre, kailangan jud na mahibaw-an nato kung unsa ang root of the cause. Then, i-observe if it is jud, then kanang one of the best way to overcome objectives and building the desire for the change is to offers any choices. Mo na siya. Then involve seniors leaders. Of course, you really need to involve the seniors with handling the resistance to change. Yeah, for example, dapat na-adjud ang ato ang mga leaders or ang ato ang mga supervisors when we have this kind of resistance. Then build a locational supports with the leaders and influence who will give the change credentially and help manage resistance. Then lastly, the communicate the change. So it's really important na i-tackle dato ni we tell them and let them believe that this change is for the betterment and for everyone's growth and development sa Osaka Hospital. Then lastly kani ano na yung pinakalasa, response to change, di ba? Not everyone can be happy in change. So ang uban is naatay resistant, manay ma-stress sila, malagot sila, di ba? Mag-provide mga feedback sa negativity. Then next one is the disagreement. Of course, dili tanan mo agree na ay mga staff ana dili agree kay, of course dili sila kanang they are not comfortable with the change that the management wants, pero wala sila mabuhat kundi mo drive sa unsay ganahan sa ilang hospital. Then ang positivity dire is proactivity. Kanang excited sila for the change, and then they give nice feedback with this, then set a possible mga ideas as much as possible, then acceptance. It's really nice na kanang tanan ganahan sa bagong implementation, or tanan malipayon kung unsay naa or unsay ganahan sa hospital. Kay we all know that everything change man good for the betterment and for the growth of everyone. So that would be all, classmates. Sorry kung na sobrahan jud ko sa time. Thank you, everyone.
All right,
Any
thank you,
question?
Novi.
Sige,
So the
ma'am.
floor is open now for any clarification for our first presenter. Any clarification from the group or questions? Okay, so if none, I just have some few questions in relation to the topic, no? So,
Yes po.
Novi, you are currently affiliated in Cebu South, is that
Yes
correct?
po, Doc.
Okay, so how does your record keeping in your hospital being done? Are you
Um,
guys utilizing electronic records?
Doc, actually we use both, Doc. We have the we call the traditional, and also the electronic records, Doc. So for if ever na ay mga naamang mga papers unsahay na dili bitaw makip, or pag abot sa ward kanang mawagtang siya. So we have the electronic system na wherein pwede pa sila makabasa, or pwede pa nila makita dito balik. So mao to ang gitawag namo, Doc, na homies, pero only authorized person lang jud ang makagamit ana, Doc.
Who among the heads who are able to access the homies?
Ang charge nurse, Doc, ang supervisors, and ang kanang if ever kinsa man ang duty for the day, mao lang jud ang maka-access ana. Then mga
Do
doctors.
okay. How about the
Hmm.
staff nurses? Are they given password or
Yeah,
username?
yes, they also have their own, Doc. Ang
Oh, okay.
wala
That's
ra siguro, ang dili ra jud maka-access ana, Doc, is ang mga nursing attendant and mga other staff lang. Pero ang mga nurses na staff jud nato din ha, they have their own password ana. They can access everything.
when are they able to access the electronic records? I mean, when are they given access, or the username or password? Are they given after they become regular, or even then those who are having job orders
Um
are also given access?
no, only the regular, Doc, ang pwede
Uh,
maka-access ana.
okay.
Yes po.
Are there any some point in which are also issues in your hospital in which the nursing attendants are the ones who are doing the requisitions, especially
Um
for the supplies, and then since the nurses are busy, or the say for example the head nurse or the charge nurse is busy,
um
are they
they
given?
um in every shift there is one nursing attendant. Sa amo na example, in the emergency, sa emergency room, Doc, we have this one nursing attendant per IT na siya, Doc. So siya ray maka-access ana,
Mm.
attendant siya pero IT siya. So pwede siya mo access if in case sa mga taggings, in case sa mga kanang sa pharmacy na mga needed, so supplies, siya ang mubuhat ana.
Does he have an access, or
Yes.
given lang siya sa nurse na siya?
Siya mismo, Dok, na adjud kay because of incline sa iyahang kwan, Dok, sa iyahang work and sa iyang position sa even na kanang nursing attendant siya, kwan man sad siya IT, so mao na siya access ana. So ang iyahang duty ana, Dok, from Mondays to Fridays, so Saturday Sunday wala ra na siya.
Okay.
Mm.
Okay. So at least no, they also have an access, because some of our hospitals, no, they are giving additional responsibility to the nursing attendants, particularly no the requisition of materials and the stocks, no, which should not be done in the institution, especially that there is a username and password being provided. password shouldn't be shared, no? And even though that we are telling them to to manipulate their homies or try to make sure na yung anak siya, no, na ang process flow na sila na lang ang magbuhat, it's still not allowed unless it is being stipulated in the policies. No? So it's very important that as administrators, if that is the case, that they do have an access, there should be no stipulation in the process flow or even in the work instruction as to what they can do in it. Okay. How about for your traditional record? How often do you dispose your traditional records? I believe that we are not keeping it for the longest period of time, but
Yeah, uh,
there's just a specific
usually
years.
we save their records, doc, within 10 years, then after 10 years mo pa na i-dispose.
Are you
Mm.
doing the scanning system in which you're scanning the charts and put it in a kuan, put
Ah,
it in a storage?
every year. We have the naman sa kwan, doc, na sa record, medical records tanan ana ilahang ma-check after if ma-discharge ang patient ang from medical records, doc, kuwaon na nila tanan, sila ang mo keep ana.
Okay, how about for those patients who are on discharge? Say, for example, um, patients are being discharged. Who is the one who would bring the chart in the medical records? Is it the nurse or is it the record personnel who would go up and
Actually,
get the
doc,
chart?
sa hospital is the one who is in medical records, sila jud mo adto mo kuha ana sa among sa mga stations.
Okay. And
Mm.
in terms of closing your chart, no, I'm not so sure as to how strict you are in your hospital in terms of compliance with the charts, no, or the closing of charts. So is it within your shift that you have to close your chart and fill out all the necessary documents within your shift, or it can be extended for how many for additional
Ah,
days for you to
no,
complete it?
no, doc. They use the closing of chart, doc, is within the shift. Then ang next na tad ang mukuan ana, dili man mo abot og day. So kung kinsay nurse for today, dapat schedule mo close ana.
Okay. Because there are some hospitals, especially that they are doing the JCI or they're in the JCI, no? There are a lot of paperwork that they're doing. And what I noticed is nurses are really focused more into the closing of the chart and more into the charting without doing patient care, although they have to manage their time, you know? So they're given specific time for them to finish all their documentation. So say, for
Yes, doc.
example, within a day, no?
Mm-mm.
They can they have to finish within a day in terms of closing their chart, although they can go home, but as long as within 24 hours they'll be able to complete everything, no? But it's really a good practice, even though that it's a JCI hospital, that within your shift you have to finish it, even though that
Yes,
there are a lot of forms, no? And I think most of the hospitals are doing that. I'm not so
yes,
sure
doc.
with Chongwa, no, because we don't have somebody from Chongwa who can share their best practices. But knowing, no, na ingon ana siya. But some of the hospitals here are the ISO accredited hospitals, such as your hospital, right?
Yes, doc.
ISO,
Yes,
no? Okay.
yes, doc.
Right. Sige. Now, in terms of nursing informatics, guys, no, most of the public institutions are using Homey. Some are using Beesbox. How about in the other institution? Let's have Miss Kulipano. What do you usually use in AceMed?
Hello, Doc. Good morning. Good morning, classmate. Doc, we usually use BizBox, Doc, and then everybody can access also, Doc, except sa amo ang nursing attendant, Doc. Amo ward clerk, Doc, ay maka-access sad sila, Doc, sa BizBox.
Okay. All right. I also wonder if the one Miss Amores from Olor, I'm not so sure what they're using, no, but most of the hospitals are trying to use these box. How about from the other institution? Say for example, though Alvin, what do you usually use in terms of your kuan? In terms of your um in terms of like these box or homies? Your hospital information
Um,
system.
Actually, Doc, before I arrived in in our hospital. Before, they are using iHomes. However, after the big, because our hospital was damaged by the earthquake way back in 2019. So, right now, Doc, talagang most of our computers kasi is damaged talaga, nangahulog sila, Doc. And our connections nangaputol po. So still, gina-repair pa na, ongoing pa yung pag-repair, Doc. Then, right now talaga, the traditional way of record we're using, Doc, kasi wala talaga yung aming mga computers right now. Nag-request pa rin kami until now. Thank you, Doc.
Okay, so that is for homies, no iHomies for the one that you're using. How about for the rest, for the others coming from district hospital? Say for example, in Bantayan,
Hi,
Janice.
Doc. Doc, ang mga kuan jud Doc, all facility na under sa Cebu province is using kuan Doc iHomies. So kanang among kuan among informatics. So we use iHomies then
Okay.
ang tanan maka-access pa jud din uh, may mga password lang every nurses. So ikaw maka-access ka sa imuha lang gyud ka ugalingon. Kaya ang ubang mga nurses, lain-lain man may mga password. And also sa doctors, nurses and doctors lang po na maka-access sa iHomes Doc.
Okay, no. So therefore, no, for public institutions, no, they're using iHomies, no. So at least we're able to compare. Although, I must say na in BizBox, it is also okay, no. Pero there are times po nga BizBox, our hospital information system cannot do about it, no, or somehow it couldn't process certain processes that we have to do in our respective department. That is why we're also using the traditional method. Okay. And mind you, these particular applications are very kuanjud, no? They're very expensive. It is we have to make sure that you know how to utilize it. You have to consider Jude special trainings, no? Coming from the newbies, especially from the newbies, during their orientation, it should be incorporated, no? So that they will also know how to navigate it. No? Sayang po natong gibayaran almost millions in certain applications. Should you want to add certain applications into your hospital information system, that would be an additional cost, so on and so forth. No? And it would be useless if others could not somehow master it. No? So we in our institution, it's these why we do have what we call these box champions. These are champions in utilizing HIS. Every time that there are questions, concerns coming from the department, we are identifying nurses who are champions in doing so. We don't want to neglect technology nowadays because it's really part of our it's really part of caring with our patient. And as you notice, what have you noticed? If you are using these hospital information system, it makes your work easier and faster. It's just a matter of encoding and then clicking and then putting in your password, right? And other departments will be able to see it. No, I believe that this is a multidisciplinary type of an application in which not just the nursing service department will be able to see it, but other department does. No, so cannot see. And we usually do the training at least once a year for the entire hospital. No? So there is this training for our nursing service department, which I'm also doing. No, I'm also teaching these nurses, but there are also some trainings in which it's multidisciplinary, meaning to say there is already an involvement coming from different departments so that we can know certain issues. And mind you, as you notice, not all are able to use it, no? Especially those who are in older generations. They don't really want to utilize this particular application. They still wanted to have it in the traditional way. But then again, guys, if this is being stipulated in the policies, if everyone is being encouraged to utilize HIS, then everyone should do it. It's not just the new generation or the millennials who are really doing it right, but there are also sometimes, no, na we also have to consider the old generation to explore and at least be open because most of them are really closing their doors, right? Have you noticed that? Every time, and I'm not offending others, no, I'm not I'm not pointing no certain staff nurses who are not doing so, no, but it's just they're settling for what is really convenient for them, no. So sometimes they would say, as you hear na, ay human naman ko anak kamo na po, ay ni graduate naman ko anak kamo na po, ay ba mga bata pa man mo kamo may maayo anak kami di naman, no? So as nursing leaders and supervisors, this is one way of making sure that our decision making in terms of providing certain tasks or activities for this older generation, no, as young leaders, particularly, I'm seeing that most of the young leaders are in their late 20s or early 30s or even in their early 20s. No, na nadyo tay mga supervisors anak nga level. It's because they are really qualified and they have a very good performance evaluation as part of the recommendation. So what we usually do for this older generation, they're just waiting for the retirement. We have to give certain we need to provide them certain activities for them to accomplish. Give them timelines in doing so, no? Um, don't be overpowered or overshadowed in terms of the seniority aspect, no? As your decision making is really important here, no? As what was being mentioned by the reporter, no? You have to decide it well. If he or she couldn't somehow accomplish the certain task, then tendency that it can be stipulated in the kuan performance evaluation, no, because naman jay uban nga kanang old generation na nawala pa jud sila na pa jud sila sa staff level, or they were able to have that kind of they able to have that kind of position pero murag ilan ang gi kuan ilan ang gi they are not accepting it anymore, no, na supervisor na before yan current case staff na lang sila. It's because of their choice. Okay, remember guys that we have to make sure that all of our team is thinking outside the box and all creative as much as possible. Now integrating with technology and informatics, but particularly in nursing, is important, no? You guys know how important is it, no? Okay, so I think that will be for our first sharer. So there are some no who are chatting in the beast box. Process flow in terms of getting chart coming from Jesse. No, I think this is from Cebu South. No, no, no. Asa ganit ni siya? Ka-AceMed. Okay, no? So the clerk, if discharged na ang patient, ward clerks will forward the medical records after they're able to check it and all the details are being completed, no? And it should be properly arranged. Right, that's correct. No, there are times, but guys, I've noticed na some of the record sections are not really that strict in terms of getting it. No, so you know what? One of the responsibilities of a medical record personnel is to check if the chart is complete, if there are no backlogs. No, and especially if the papers are chronologically arranged. It's not just they are just getting it in the ward and then putting it and store it in their area in the medical records, scan it, and then dispose it right after. Use it if the patient wanted to use that for medical abstract. No, their responsibility is not just limited in that. No, they have the power. No, to really reinforce to the doctors and to the nurses if these are complete or not, and if there are backlogs. They can even stricter if nurses could not be able to plot certain entries in the chart and if it's being forwarded in the medical records. And if I say na, if I'm the medical record person and would say na, no, I will not let you chart anymore, it's because it's being forwarded, then I can endorse this one to your supervisor for disciplinary action. They have the power to do so, no? Especially na mga nurses is ato na mag-complete, even doctors, no? And there are no more insertions. Ay ma'am, insert the ay ko, kay napay kuwang, no? There are times that they're really lenient, no, and they're just accepting. It's because siguro of our culture, now we know each other, we do give and take relationship. No, that's also important, but it's unhealthy anymore if we're not following processes because people might abuse it, no? Have you noticed that also in our nursing kuan, in our nursing department? The more that you are lenient with your staff nurses, the more that you are kind to them, the more that they'll also abuse you. And if you're strict food, they don't usually give give you some kuan, they will not give in return, no? So say for example, they are asking for a favor and you're not allowing them, it's because of your exercising your authority. Tendency, if you'll be asking them to have certain 12 hours duty on their shift or to extend, some of them would really say no, no? Okay. Then again, 12-hour shift is not really mandatory for our staff nurses. They really have the right to say no. However, as nursing leaders, guys, I just would like to inject this insights or this idea. If your staff nurse won't be able to go on 12-hour shift, but there are no one in the department that you can pull out, you can really issue insubordination to the staff, compromising the hospital operations. Always remember that in our job description, there is this certain part, no, na and other specific related work to do. No? So if that's the case, that means to say that you agree those other related tasks that you signed during your JD, no, the one that you are the job description that is being forwarded by Human Resource Department. Hopefully they try to explain it. No, I also have issue on that because some staff nurses would say, no, it was not stipulated in the JD, sir. And then again, I have to include that in the orientation. As a nurse training officer, I have to supplement, no, the gap that they don't know and they're not being explained into. No, so detail by detail, basic by basic. And going back to the 12-hour shift, if no one would really wanted to have no that kind of 12-hour shift, then you can issue subordination because you're compromising the staffing. I mean, the hospital operations. Always remember that we are standing in terms of doing operations. No, we are not here. It's because we are just doing our part for an 8-hour shift, get a COE with an exemplary, no absences. But then again, if that would really call us to extend our duty, then we have to. We can really reinforce them. No? But I'm not saying you also as a supervisor should look for somebody in the area that you can pull out. Maybe you can look at the staffing at the operating room or talk to the supervisor who's at the or cascade it to the supervisor. The supervisor will be the one to look for somebody in the entire shift who can do that. No, and then you have to explain it to the staff. No, I called I called DR. No, and then it turns out that I did not see anybody who would really fit in covering the one who is absent in your department. So better yet, you have to do your 12-hour shift. And then the staff nurse say, no, 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 I really should ko na lakaw. Sorry, you guys, sir. That's the time that we can issue insubordination. It's because the hospital operation is being compromised. But then again, kung nadyo makita, go ra. No? Kana siya. Okay, so I know that some of you are kuan no kanang able to relate, but hopefully I can somehow give you some ideas as to how important it is put no in our practice. Charts before sending to medical records. Yes, that is correct. You have to check the charts. How often do you do chart audits, by the way? Miss Novi, how often your supervisor is doing audits in your chart?
Usually, Doc, if pwede dyan niya i-audit everyday, i-audit dyan niya, Doc. Lagi,
Okay, no, that's correct. No,
oh,
especially that you're
kay
the
every
supervisor
by
in the
time to
area.
time jud siya if naa-jud siya i-check jud na niya one by one, Doc, and then after niya ma-check if na yung mga something problem i-shout out dahil niya sa among kwan
GC.
tell yes po nga
Have
na
you
siya
noticed that it is being kuano? Have you noticed that if it is being cascaded in the GC, ang ato ang mga staff is mahiubos na dayon, no? Have you noticed that? You also have to consider that in terms of your management with your staff. Make sure that if there are any problems, you can PM them personally, no? Na huy ang imuhang chart lagi kay kulang, wala kay entry sa imuhang
pero
butang ta, very
actually
easy monitoring. Sige.
ang iyahang pagsulti, Doc, is kanang dili siya mo drop og names.
Uh,
Unsay mo kana siya, uy na ay lacking diri ana ba?
uh,
Mo
But you
ana
know
siya,
what?
Doc.
she will not be able to drop names. It's really hard for us to try to fish somebody who is really doing that particular lapses or lapse. No, it's because you really have to point directly the person. If she cannot drop names, then better yet do it personally, and then she can do general announcement in the group chat. Na, hoy, I've
Mm,
noticed, but there should be a PM for that person who
I guess,
committed the
Doc, I
mistake.
guess
No.
she's doing that, Doc. Pero wala pa man sa diri na ako sa akong part, so mao siguro.
Oh,
Uh,
yes, no?
when
So,
she's
kana
doing that,
siya.
and then i-acknowledge na niya tanan sa GC kung unsa iyang na-discover. Nga
Yes.
na.
Part of your yes, no, part of doing your rounds, you can somehow audit at least randomly, no, in the chart,
Mm,
particularly two charts per staff or three charts will do. You have to check if the entries are right. They might be able to close the nurses' notes now as early as 9 o'clock in the morning, and their shift will end up by 2 or 3 in the afternoon. They might be able to sign medications now, which should not be signed yet because it's still due for 12 and it's around 10 and she signed it, no?
yeah.
And we have to call their attention, no? It's part of chart audit. And the completeness. You happen to know that the work, no, of a head nurse is to really audit the charts, no? But if you don't have any head nurse, but you only have a charge nurse and a nurse handle, particularly, I believe that this is really rampant in the public private institutions na naalan siya mo handle o nalan siya charge nurse on that particular shift. It's very important that the charge nurse should check the chart of the juniors, no, because kana siya. And also looking into the records, no, medyo taas-taas maguni ang record. It's because this is really important and you would like to tackle it in terms of what do you do, man, usually if the staff would commit errors, because knowing that this particular kuan bayahan, this particular actions that they are having backlogs in the chart would somehow progress to disciplinary action. And this would fall into incompetence or negligence, probably, no? Incompetence, no, siguro, it's because they're aware of doing it so, but why is it that it is not well done? So incompetent. How do you do that, Miss Kuan Tormon? Does is somebody in your area? Does somebody in your area received already disciplinary
Um,
actions such as first written warning?
uh, naay nga na, Doc, eh. Naa. Mo
Uh,
kuan
oo.
unsay explanation letter na ipabuhat
Yeah.
IR, yeah.
Maybe
They
a verbal letter.
if first, Doc, is kanang mo warning, and then next is kanang need na jud siya mo kuan mo
Yes.
hatag og explanation nganong ing ato
That's
kay
good.
dili siya good.
Yes. Although we are saying that this would be an additional part of our staff na nasa ni siya mo, so na nasa ni rounds sa ni diri ay kapoy kay tanan maimber na ta. No? But always remember, guys, that we are just following and reinforcing them the policies, no? Work is work, no? Trabaho lang, wala tay personalan. If you are not able to do so, you are aware that the hospital is an ISO accredited hospital in which paperwork is really important and you're not adhering it, then why is it that you would like to work with us? No? So in that case, ana ba kung stricto lang jud kayo istorya. Pero then again, ayon sa ninyo, grabe hapon og stricto kaayo. Kay kung stricto na pud kayo, wala na mo staff, no? Mga resign na sila. They are resigning, it's because of the management and not because it's not because of the workload, no? Kana siya. Okay, but anyway, no, copy paste lang ang notes. Parihag after making no, as in, no, naadjud ko ana. Even how many times do I tell them, but always remember, no, do not don't be tired in giving them insights as well as messages from time to time. That what the we really say, for example, no, if their after is really copy paste balik balik lang jud siya, you have to tell them that whatever happens, if there are any complaint coming from our patients, your FDR is really important in terms of how it will save you. I totally agree on that. It's because there are some cases in our hospital in which the staff nurses was saved. It's because of her FDR. No, and it was really documented well. No, the thing speaks for itself. Res ipsa loquitur, right? And if that is the case, no, it's already there, koan guys. It's already their prerogative of doing so. Then there's a big chance that we couldn't somehow kanang defend them if this is being brought to court, no? if they're being given if they're given some subpoena, no, na if ever na allergy mo complain nga patients, no, particularly in a private hospital, it's very important, should. It's because our staff nurse, our patients are really kuanjo pa ya. They can really afford. So they are looking into the best care that they can get, and somehow the staff will not be able to deliver it, no. So they're expecting it because they're paying lots and lots of money and pesos, no. So kana siya. Then again, if dahil jud ka yung ulo sa ilang FDAR, what I highly suggest is challenge your head nurses first. Okay, head nurses, what did you do to your staff? Okay. Do not as a nurse supervisors, no, you have to escalate first the problem as to what the head nurse should do. There are times nga kita naman ang naa sa supervisory or managerial position are giving power, no, directly to our staff, and these head nurse are not exercising their authority. So I always question my head nurse, in your level, what did you do? No, I am not really strict with my staff, but I'm really strict with my head nurses. No, sila jud akong kuan. Di kay ko mga di jud ko baya mga saba pud og nurse. No, I don't do that because I'm a type of kanang leader who is kuan. Sometimes no kapoy na kaayo, I do lazy spare kapuyan ako kanang kuan na kaayo kanang kabaw na mo siyang gibuhat mga dagko na mo mga lisensya usahay dili kasabot di sa ko ganahan mo hatag og reprimand kay mo final warning na or mo final written warning na lazy spare ko kung say mahitabo o mahitabo, no, but there are times, no, nga democratic pod ko. I'm a type of leader who is really democratic. I listen to everyone. So kana siya kung dili magamit sa imo nga dili ma-prioritize imong head nurse, ikaw na mismo ang mo intervene. Pero always make sure that the head nurse are also working. They're placed in that position. It's because that is part of their responsibility. No? Organizational chart, ha, mugawa siguro na sa yung comprehensive exam. Although I'm not giving exams about organizational chart, but there are a lot of probably Doc U is really kuan fond of giving comprehensive questions about organizational structure. So kana siya ladder of communication. Okay, so some of the chat groups are affirming, no, so you guys are able to relate, no, which is really done now in our institute, which is really kuan jud kanang practical learning institution. Okay, I think that is a very good discussion, no, in terms of kana palang daan ha records. We have to perfect it. I'm not saying that we have to perfect it, but there are instances that we can perfect it, no. So not all the time nga kamo jud ang pinaka-perfect jud na organization. I don't believe on that, no. It's because in every organization there are issues that you have to work on. There's no perfect organization here in our province in Cebu, but the best way for us to make it perfect is to really involve the people, no? And at the same time you really have to make the best decision making on your end, because at the end of the day what matters most is that you work efficiently and effectively. There should be no backlogs, no, coming from you and also your from you and your staff nurses, because the more backlogs it's inefficient, so it should be effective and efficient. Yes, Miss I Plaza.
Ay, Eldo, kanang mo share ako do ka about sa we need to prepare and we need to check our charts kay especially sa amo ba in our facility we transport our patient, so diha pala na daan we need to check it kay ikabot sa facility nga transferring ang hospital na transfer especially the Soto ay sus mo ribalida gid na sila dok. That's why dinhi pa lang amo na siya i-check ang chart kay anytime mo ask na sila kay what if the patient what if it happens unpredictable kaayo nag-arrest ang patient and then nakalimtan og hatag it ato na tambal nakalimutan og usa to na procedure o wala na sayop na nadaan. That's why every time na may transport na may i-transport na patient, we need to check and prepare the chart kay di man dyan nato mahibaw matabo sa patient during sa pag-transport ba maybe unpredictable mag-arrest or mamatay ang patient. Mao lang na siya dok kay na experience pud namo dok ba nakalimutan pag chart nakalimutan pag uh, pag pag-record sa medication. Kanara daw.
Right, no? That's good. You have to be effective, no? That's what I mentioned. But now, what's the difference of being effective and efficient? I always include this during my orientation. When you say effective, no, you are good at it. No, everything is being closed at the end of your shift. Medications were given, everything, no. However, around 5 o'clock in the afternoon, you're already in your kuan in your house. Somebody called you that you've missed an entry of your nurse's notes for two charts. That makes you less efficient. Okay. A very good example again is for you to be efficient but not effective. No backlogs. Medications are given. Everything went smooth at the end of your shift. However, you finish your charting around 5 o'clock in the afternoon. But then again, your schedule was only 6 to 2. That makes you less effective. So how can we do that to become effective and efficient? It should be complete, and at the same time, you should hit the time or the expected time. That is why you also have to do time management. No, I believe time management wala ni siya sa ato ang kuan, no, sa ato ang topic. But I really would like to include the but it's kind of long na niya. Labo na daan na food may certain topics, no? So time management and effectiveness. And by the way, I just would like to give no an idea po in terms of transferring patient. We all know that in Cebu, we have this e-referral, right? 'Di ba? Naataan na mag-refer ang mga doctor through kanang
Yes,
Yes,
Doc.
Doc.
application
Yes,
to the
Doc.
Yes, Doc.
DOH.
We practice that,
Yes,
Doc.
Doc.
Yes, I
Yeah.
hope that everyone practice that. It's because that's one way or another na we are accepting patients na kanang who would be admitted in our department, or it can somehow kanang give us an idea that somebody is coming the eye, particularly those who are coming from their homes. No, there are times nga magsulat na daan la nalagi ni pop up. That gives us an idea na jud ang patient. But then again, during endorsement, it should be complete prior to transferring your patient. I hope that you transfer your patient who are already stable and are being stabilized in your respective emergency room department. No, do not take the risk of transporting patient. No, even though that the transport is from ER and also in the wards, do not kanang afford in terms of risking patients who are not stabilized in transferring, because there come a time that your patient may got arrest, no, or at the middle of the transport, during the transport at the CT scan department, or probably in the x-ray which is being en routed. There are times na mag-arrest yun na ang patient, so don't take risk. Sometimes the staff nurse, have you noticed na mo yun, sir, confirm lang po akong i-transfer ang patient, you knowing that the nurse is already 5 years, no, on his kuan, on his practice, and still would like to confirm, try to tag that as a red flag, because they wanted to make decisions not on their own, but it is your liability already. They're asking permission for you to do so and asking confirmation, so that if there's something wrong with the patient, I've already talked during the investigation, I've already talked to the supervisor, and the supervisor told me that I can transport the patient. It was Sir Adriel who told me na dili ta manawat og pasyente, ma'am, ana-ana. And then there was a problem in the mancom na mauni siya na wala gidawat ang pasyente sa consultant, nahiubos ang consultant, di na magpada og pasyente. No, it's really rampant in the private institution. Another thing, wala na swab ang patient, sugot man gud to si kuan infection control nurse nga amo ni siyang i-transport dito sa clean area kay lagi complete ang booster, but knowing that the patient has signs and symptoms, it was already been cascaded and it was already been oriented in the emergency room staff na natin ingon ana nga way of doing so. So what you should do on those type of staff, you have to re-question them. Say for example, the staff would say, sir, kanang inform lang ko na ang patient nag-arrest ba niya, amo untang i-transfer. Okay, then you ask the nurse, do you think that it is proper for you to transfer the patient if it's not stable? Then the staff nurse would say no. What then would be your decision? I'll give it to you. No, mo ana jud na, mo jud na silang ingnon ana. Sir, kanang dili man pwede sir, o sige ako na lang ingnon si doc sir. At least they have the accountability of doing so. Part of your decision making is to enhance or sharpen their critical thinking and not just depending into the leader. Knowing that the patient is not stable, imo jud kay ipugos. Then give realization. Knowing that your patient is not stable, do you really would like to transfer it? I would like to know your answer. No, man, strict to lagi ni sister. Pero guys, hindi ko kaingon na sa akong staff. Pero that's the way how you should do it. No? Another thing, sir, wala na tayo admission, sir, no? Di na ta manawat kay ato ang ICU kay tulo ang pasyente. And they know already that in the ICU, the maximum bed capacity is 8. Sir, wala na yung staff. No? Wala na yung staff. Mo ta manawat, sir, no? Sakto ba, sir? Ana. So how many beds do we have in the ICU, sir? We have kung sir, 8. And how many patients do we have? Oh, they're aware, huh? They're from ER and they're aware of the census because they are also researching. Tulo. So do you think that we don't want to accept patient from your shift? And they can realize, no, sir, naa pa. How about the staff, sir? Then you have to tell them na, let me be the one to look for the staff who will be assigned in the ICU on the other shift. But then again, what then will be your decision? Admit, sir. Then tell to the patient that you're going to admit them. Na. So para sila jud mismo moingon nga ako ning gidesisyonan dili kay nagsalig lang ko sa supervisor. Unsa ning chika sa group chat? Paubanan jud nako og junior consultant, doctor. Yes. It's very important na adjud na sila, no? It's because kung mag-code man gani, ito pwede maghatag-hatag og FP, ito pwede mag-defibrillate without doctor's order. Okay? Although we happen to know na 20 years na ka, no, sa nga profession din ha sa inyong institution, pero giving of management, medical management which is not being ordered is a no-no. Okay? Hindi na siya pwede. Good thing, no? Makasana all ta junior consultant jud ang magkuyog. Sa amo is only resident, sometimes PGI. No? But then again, naa jud gihapon na maka-order. Sige, I think that's it, no? I just would like to highlight the importance of medical record. Mura man good siya makonect na to, no? Sa certain situationers. Okay? Oh, this can be a very good topic in terms of your thesis, no? Would you like to know the reliability of the record keeping in your department? Pwede ninyo siya i-thesis, no? In terms of record keeping sa mga staff, no? This is also one of the trends right now or the issues right now that most nurses couldn't really perfect or couldn't really comply. No? So this is a good topic for your thesis if you want to. Just find for the best tool lang jud, guys, no? Na si for example, kaning tooling mo na, I always make sure to finish the record on time. And blah, 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 blah. I always make sure that it is complete. Ana lang po, no? Na mga tool. At least you're able to measure, no? This is a very good research topic. Okay, so who's the next reporter? Can we have at least 20 minutes for each reporters, perhaps? We still have 2 because we've done with Miss Norby.
Hello, Doc. Duha ra mi mag-report, Doc, mag-present, di
Ay,
ba?
duha na di ay?
Yes, Doc,
Murag
kay si
nag-drop
Sarmento. Yes.
Sarmento.
Okay, thank you, Ma'am
Perfect. So,
Wala
abi
Jess.
pa
na
may.
ko kuan. Sige.
Oh,
Mao di
Yeah,
ay,
may.
kung anong taas man, so nalimot na sad ko og
Oh, kay
edit,
ang
no?
report niya, Dok, ako na lang ni-report.
Sige, mao di
Yes,
ay.
Dok.
So, sige,